how can we call ourselves true autonomous practitioners if we have to seek clinical authorization in many cases? Well, I actually think like autonomy, I kind of get a little bit of a being up on it, really. I think everyone who works in pre-hospital care in some sense is autonomous. Like there's varying degrees of autonomy. Ultimately, like consultant in emergency medicine is still, most of the time expected to fall within national clinical guidelines, with the occasional deviation from it. I think, how do you phrase autonomy? The autonomy to deviate from guidelines where appropriate. Well, I think a lot of people in pre-hospital care have that. I think the support actually enables people to safely deviate from guidelines, and you could argue that makes you more autonomous in a sense. I think autonomy is a clinician-centered phenomenon, and I think what we really need to be thinking about is patient-centered, isn't it? And that might sound a little bit cliche, but I think clinical authorization can actually do more to deliver the right thing for patients. And so, as a pre-hospital care workforce in the UK, that maybe that does that not make us more autonomous? We can do more of the right thing for patients. I don't know. I see what you're getting at. It feels that you've got to ring someone for them to agree your decision. Well, actually, I think most of the time, I think when you move up through the profession, you get to more what you'd call autonomous roles. I think actually you're not ringing for that yes, no often, but I think you'd be surprised how high up the very tall tree you have to be before at some point you're not ever ringing anyone for authorization on something or other. It's just that you ring less.